Welcome back. It's good to see you again. And this is another highlight of our program. I hope you have enjoyed it as much as I have. Term lung cancer survivor. I will be 16 years as of Monday. So thank you. I can't take credit for that, but I appreciate the sentiment. So this will be the patient panel portion of the program, living with a KRAS diagnosis. And we're going to have Jessica Buscho, James Hyder, Jackie Keast, and our own Terri Conneran. We've got two folks who are virtual and two who are in person. They're each going to be sharing briefly about their story, and then we're going into the panel discussion. So first up is Jackie.
It was like, my life was just starting, and I had, I was pregnant with my second right before he was born was when I was diagnosed. And, I'm thinking we're just going to complete our family and we're going to, have this great life, and shot to the gut. I was about 30 weeks pregnant, and I had like a cold pretty much. I was very mucousy. I was coughing a lot. And at one point I noticed that I was coughing up a little bit of blood. My cough just lingered and lingered. So I had my CT scan, and I was there on Friday night, and they told me that I had cancer. And they thought it was like pregnancy cancer. They didn't know. They didn't even give me a biopsy at that point. They had just said from the CT scan and that it was metastatic. And I'm like, oh my gosh, what, it was like all this inflow of information. And then, they admitted me, and all these doctors were, coming in. They're like, it's not cancer. I don't know why they told you it's cancer. And I'm like, oh, phew, okay. What is it then? Because they're all coming in and they think I have tuberculosis or this or that and some sort of infection. And, I was just in the hospital for a few days. They finally did a biopsy and they sent me home. And that Monday morning, or what I think it was a Monday, I met with the pulmonologist, and that's when he told me that I had lung cancer. So I had to, at that point, I just had to first come to the realization of the cancer diagnosis. I had to, it was probably a few days of curling up into a ball. And then, tumor testing, second opinions, and, high-risk pregnancy doctors, and the whole, rigmarole of everything was just like a blur. But they ended up inducing at 33 weeks, and I had little Bill, and he was perfectly healthy. He had to be in the NICU for a few weeks, but he was good. He was 5 pounds. It was like everything about you think you're gonna just die right away. Pretty much, you have no idea what's gonna happen. The worst things in the world that when you grow up is cancer. So I started the chemo, and I did really well with that. It shrunk my tumors a ton. So I only had tumors in both lungs. It didn't at that point go anywhere else, but I had multiple tumors, and they were fairly large, like 9 centimeters, and pretty much in both lungs. So the chemo shrunk the tumors a lot. It was a really good response, and I was able to stay on a maintenance for almost 2 years, I think. So, and then once I started showing a little bit of progression, I started looking into clinical trials. I feel like the first year, it was like going through the motions, doing the chemo, thinking I was going to die, and once that year hit, I was like, okay, still here. things are okay right now. You know, by a year, I had met plenty of people, and, you know, I knew it was possible to live past the 9-month mark, I think was the mark when I was diagnosed of like the typical death time. I was like, okay, well, I passed that initial, you know, year mark, and I'm not frozen anymore. Let me start seeing, you know, what kind of research is out there. You know, I wasn't able to get any like next generation sequencing, because there just was never enough tumor cells. They were only able to like test specifically for each mutation, and then that was it. And I was at Dana-Farber, and I was really interested in like a vaccine trial, and I really tried hard to get there. You know, every biopsy I had, it was like not enough cancer cells in the biopsy. And I've just been able to live fairly normally this whole time, you know, apart from having to go away for my appointments and just the really random side effects that aren't that bad, really. I've just tried to just live normally as I have been able to. And I don't think the kids know any different. You know, it's been good. 6 years later, I'm still here.
Powerful story. Now we're going to James.
It all started for me as I was an avid runner, running every day. At the time, I'd been running for, I don't know, 600 and some days without missing a day. Went to the doctor just with bronchitis, thinking I needed some antibiotics to get through it. And he diagnosed me with the flu, and I went on about my day. He did a chest x-ray to make sure I didn't have pneumonia. And in that chest x-ray, he saw something that didn't look quite right. And from there, that kind of got the ball rolling for what eventually was a biopsy surgery, where we went ahead and did a lobectomy. And in that lobectomy, we found a fairly decent ping pong sized tumor and about a tennis ball sized cyst. It was soon after that then that I received the diagnosis of KRAS. And yeah, that was the beginning of this whole journey. And that was again in June of 2016. So we high-fived the doctor because, of course, catching it all in one lobe is considered curative surgery. So we high-fived the doc and proceed with 6-month interval of scanning. The first scan was clear. The second scan, the following June of 2017, showed that there were 13 new cysts in both lobes on the right side. So at that point, then we knew we were dealing with a lot more. So off we went for second opinions to figure out whether we should take the rest of my right lung or whether we should start a regimen of chemo. And after going to a couple of other major cancer centers, in addition to University of Virginia, where I was being seen, the decision was made at that point to start chemotherapy and immunotherapy. And we did that for 2.5 years, where we were able to not take out my lung, able to continue. I actually started another running streak during that time and ran every day without missing a day through 2.5 years of chemo. It was then in the fall of 2019 that we noticed the lining of all those cysts starting to grow again. And that was the telltale sign. When you have a cystic presentation, there's not the normal kind of growth of a tumor that you would see. You're really interested in the lining of the outer lining of the cyst. And so as that cyst started to get tight, get brighter and larger, then that was the sign that we needed to do something. So at that point, we started another round of second opinions, and I ended up, kind of long story short, having most of the rest of my right lung removed. We found a very skilled surgeon, a thoracic surgeon who was able to salvage the top little portion of my right lung. So I jokingly say I have one lung and a nub. But by doing that, it allowed for a much faster recovery, and they were still able to take all of what they could find. And so that's where we're at. So 7 weeks after that surgery, I started another running streak. I believe that was March 25th of 2020. And I've run every day since then without missing a day. So thanks.
Thank you, James. So we're going to now go to Jessica, and I think you'll enjoy this testimony as well. I'm sorry. Yeah, that's right, Jessica. Yeah.
Hi, can you hear me okay?
Let's hear that.
We're working? Good.
Yes.
Okay. Okay, good. Hi, my name is Jessica Buscho. I am a stage 4 colorectal cancer patient with the KRAS mutation. I do have something in common with most people there in that I have lung tumors. So I was diagnosed with stage 4 colorectal cancer and dozens of tumors in my lungs in 2017. So it was about 4.5 years ago. Since then, I've had 55 infusions and been basically on systemic treatment for the entire time, or sometimes systemic treatment the entire time. So I've had 46 rounds of chemotherapy. I've had 9 rounds of a KRAS vaccine and immunotherapy clinical trial. I had my primary tumor removed. I've had 12 lung tumors ablated. I had my brain tumors removed, and I've had multiple sessions of gamma knife for brain mets. Most recently, I have become a participant in KRAS G12C clinical trials. And my involvement with KRAS Kickers has been instrumental to staying on top of research in this area, and I really appreciate what they're doing. So I'm really grateful for this group and grateful to be part of this conference. I say all the time that my biggest motivation is to stay alive for my 3 kids who were just 6, 8, and 10 when I was diagnosed, and of course for my husband too. And the research that's happening with KRAS right now and being here today is all about sharing hope, and I'm really excited for everything that's happening, and I'm grateful to be here. Thank you.
Thank you very much, Jessica. Now, you all know Terri, of course, but a lot of you might not even know how she was diagnosed. So we're going to have Terri share her story.
Hey all, I'm Terri Conneran, and I'm from Charlotte, North Carolina. Just nearly 5 years ago, I went into the doctor thinking it was allergies and asthma and what have you. Doctor could hear the fluid in my lung, and so we did a chest x-ray, and from the chest x-ray, she could see that there was definitely a tumor. Went through normal course of antibiotics and what have you. And over the course of the following month or so, I did biopsy, and it was determined to have stage 3 non-small cell lung cancer, chemo, and lobectomy. And just shy of 2 years later, during that 2 years, I was considered NED, no evidence of disease. And after that NED, I started just kind of like getting my rhythm, and I was kind of feeling pretty good about myself. Got involved with the lung cancer support group, started getting my feet wet a little bit. Went to my first big lung cancer summit, and at the big lung cancer summit, walked in, and I was like, wow, I'm going to be pretty impressed, see other people that I have something in common with, and walked in, and they were all breaking up into these little groups, and the EGFR people and the ALK people, and I didn't have any people. And I was really bummed. But I just plowed through, and it's like, you know, I'm going to learn about this, but I learned to ask about biomarkers. And I went back to my doctor at my next scheduled visit, said, well, what's my biomarker? She's like, well, you really don't have one. And it's like, okay, well, like, do we need to do more testing? No, right now you're NED. Well, first recurrence came back and dealt with that, but fortunately I was able to deal with it with an ablation and with radiation. And so there was not really a situation where they go in and get another good tissue biopsy, and the ctDNA thing really wasn't a particular option for me at that point. So it's like, okay, well, finally we went through a couple of different rounds of different radiation and different recurrences and went out for a second opinion. I wanted to make sure everything was like on track. At the second opinion, I kind of a little bit of an attitude said to my second opinion doc, well, it's not like I have a biomarker. Well, she says, well, you have KRAS. It's like, all I knew was that's not good. And that's all I had learned about it. So of course I went home fully expecting to go home and find a group of KRAS patients like I had already seen at all these big, large summits. There wasn't a big group of KRAS patients, despite the fact that I kept looking. So the KRAS Kickers were born. That night I was laying in bed and I was thinking, what do I really want? I want a community. And what do I want the community to do? We want something in common, and we want to kick cancer's KRAS. And I thought, that's kind of catchy. I kind of like that. And so we became the KRAS Kickers. And I reached out to the organization and said, hey, do y'all know anybody who's got KRAS? And so James was one of the people that I was introduced to, and a couple of others, just a small smatterings of people. And I asked my doctor when I went back, I said, how come you didn't tell me? She says, well, it wasn't actionable. So there was really no point. I didn't want you to lose hope. What she didn't realize was by not telling me, she was taking away my hope. She wasn't empowering me. She wasn't even voicing into me that she had any confidence in me as a patient to be on my own team, to have enough information. And that's really totally lit a fire underneath me, and what part of like how the whole KRAS Kickers thing came to be about. And I feel like I spent half my time standing on the rooftop screaming. You'll notice I asked my children to leave because they don't need to hear this part of my story. They hear it every day. I'm pretty much get off, Mom, get off the rooftop, stop screaming about biomarker testing, stop talking about KRAS cancers. We get it. You get it, but not everybody does. And so now that's what we do, is we connect around it. And I like to say I've been like 4 times in and out of NED. Statistically, I'm going to continue to be in and out of NED. I'll hit 5 years as a survivor in January. And that's when you start falling off those research charts. And that's not what anybody wants. We need to start thinking in terms of this needs to be intentional for 10 years. So that's my story.
Thank you, Terri. That's great. And I know you said biomarker and you shout it from the rooftops. And I think everyone here, probably online and here in person, they know about the importance of comprehensive biomarker testing. However, this is being recorded. So let's talk a little bit more about biomarker testing. You've shared, and all of you, I think, have touched on how you found out you were KRAS. But, what about the process of biomarker testing? Could you, any of you touch on it a little bit more? And how did it change, if at all, your treatment options or your cancer journey? And I don't want to leave off Jessica and Jackie. So you guys just jump right in if you have something to add to this conversation, please.
I'll start then, if that's okay, because I was diagnosed in 2017 when biomarker testing was basically brand new, especially in colorectal cancer. And I was diagnosed in a community center. So my community oncologist didn't even understand or offer biomarker testing. I believe I was on my 4th, second opinion by the time a doctor brought it up, but he talked about it so quickly. And it's just, a series of letters. And in colorectal cancer, there are some that happen more predominantly. And he just rattled letters on and on about the ones that might hear. And then when I got my results back from him, I like couldn't even remember what he said. It was very overwhelming. But what made a difference for me once I got my results was connecting with patient communities, sort of what Terri was talking about, and understanding that by watching other patients who have similar biomarkers to you and sort of seeing how their cancer behaves, it can really change your own trajectory, because especially if someone's further along in their treatment than you, like we're learning now that in colorectal cancer, KRAS G12C mutations don't respond very well to second-line chemotherapy. So it's, you know, something that when we share this with other patients, then we can say, okay, so maybe you need to try a G12C inhibitor earlier in your course. You know, so these patient communities are just invaluable, and eventually, I think that we'll be able to have these for all the different types of biomarkers. But I'm really happy to be here with KRAS.
I hope you're right. And I think that's really important what you said, Jessica, about, I mean, it's patient empowerment. And also you, you know, you hinted at this was a lot of it was with the patient advocacy organizations that helped empower you. And I hope that's what others are doing now through your sharing your story, and Jackie sharing her story, and James and Terri. So James, would you like to add any more to the biomarker testing? Like, what would a patient who has heard about biomarker testing through the advocacy community, but their doctor hasn't done it or hasn't told them the results, how would you suggest a patient handle that?
One of the things that I enjoy the most as a survivor is actually being a phone buddy to people who are newly diagnosed. And this is something that comes up every single time. Which is, what do we do if the doc isn't doing it or doesn't bring it up? And it is, you either need to bring it up yourself, and then if the doc is still resistant, you probably need a new doc. You need to find yourself a comprehensive cancer center. You need to find yourself a thoracic oncologist. If you do those two things, your doctor's going to talk about biomarker testing. This is going to be something that's going to come up as part of the conversation. But it's vital. It's impossible to treat this disease if you don't have that information. And if you have that information, this can become an amazingly treatable disease for some variations of what can come out of a biomarker test.
Excellent advice. Now, I think I heard maybe every one of you say you got a second opinion. If that's not true, speak up now so we can talk about that. But I would just share a little bit about, I was a little nervous about getting a second opinion, and I want to encourage really every single cancer patient to get a second opinion, no matter how much they love their doctor, no matter how much the prognosis looks. I mean, just get a second opinion. Would anyone like to address the second opinion?
I can add to that. I would even go further to say sometimes you need a third or fourth opinion, you know, depending on what you're actually asking about, what stage of your treatment it is. I mean, you could be working, you know, with your current treatment and doing well, and you want ideas for a next step, or maybe your oncologist recommends, you know, a second line standard chemotherapy, and that's not necessarily maybe what you want to do. It doesn't hurt, and they will not be offended. And if they are, that's not a doctor that you want. I think that I have found, especially with my primary oncologist in my local area, that he was, you know, more than willing to work with any cancer center, any doctor at any cancer center, and work in unison with them at all times and help them out. You know, if I was getting treatment there, he would run tests at home. He would, you know, be on the phone with them to figure out what was best for me. And I feel like that was crucial. And I've been to many cancer centers because I'm the type that if I don't like the answer from one, I'm going to another one. And until I may end up full circle back to where I started, but at least I know that I looked at each and every available option. So that's my
very good advice. Would anybody else like to comment on the second opinion and the importance of it? Terri?
You know, we were really hesitant. My husband and I were very hesitant to go and get that second opinion. We kind of had the sense that if we went and saw another doctor, we'd make the doctor mad, that we'd hurt their feelings, and then maybe I wouldn't get the best care. And we kind of like went back and forth over that conversation because this is new to both of us. Having this go through these sorts of things. And I finally was like, from everything I learned from the advocacy community, again, this has been like the lifeblood of keeping me going as a patient, as a person. That's why I learned it was okay to get that second opinion. And so that's what we went ahead and did. And subsequent to doing the second opinion and getting more involved in advocacy, what I've come to realize is that the peer medical reviews that they do, these doctors are accountable to each other. The scientific panels and the charts and things that they show, they're not operating in a silo in somebody's basement. They're talking to each other's doctors, and they want to show them, and they want you to have the best care. So no, it was absolutely the best thing to do.
Now, I've also heard some of you talk about clinical trials. So important in the cancer community. You know, there's some misconceptions about clinical trials, which I dare say we may have all had before we entered our own cancer journey. But those of you who have been in a clinical trial, would you like to share your experience and maybe even tell us how you even found out about that clinical trial, because if you go to clinicaltrials.gov, it's a maze. So please, who would like to share? Online? Jessica?
Sure. Since I'm a 3-time trial participant, I will say my very first trial was a first in human trial. I was the first female ever to receive the drug. So that's kind of one of my proud, braggy things that I like to talk about. I'm really into science. So I just love being part of progress forward. The reason I became interested in clinical trials is actually because of being involved in patient groups and hearing the buzz about G12C in particular, and knowing there was, I think it was in 2019 or maybe in 2018, it was in 2019, I was volunteering at a conference, and someone just said the words to me, oh, they think that G12C is going to be actionable. It's going to be treatable. And I just said, oh, what? So I went back to my patient groups and started asking around, and yes, I found out that this was going to be a drug or a target that they were going to try and drug, but the only way to be able to do that would be to participate in clinical trials. So in May of that year, May of 2019, I hopped on a plane and went to go visit 2 different people that are studying that and opening those trials. And I was just so amazed and inspired by their depth of knowledge, because when someone is going to be running a clinical trial, they really specialize in what that trial is. And then when I did start to actually participate in a trial, I was also amazed and inspired by the care you get. It's incredible. It's like the best spa version, you know, because you're being watched so closely. They want to know what's going on. So you're on a new floor at the oncology center in a special clinical trial suite. You have a special phone number you get to call. I have had the best experience on clinical trials, and I just feel like there's so many misconceptions, and people say, oh, you'll be a lab rat or you won't be taken care of. And that is definitely not the case. And I'll sign up for my next one as soon as it's ready.
That's great, Jessica. I love what you just said about, you know, I mean, when you're not in a clinical trial, you're going to get the standard of care. When you are in a clinical trial, you're going to get the standard of care plus another level of care. So I believe you really get superior care when you're in a clinical trial. So that's great. Who else has been in a clinical trial?
I have.
Okay, would you like to share, please, Jack?
Sure. So I'm actually in my second one now. My first one, I knew from the beginning that as soon as I found out that I was KRAS mutated, that there weren't many options available apart from chemo and immunotherapy. And I knew that I was probably going to be looking for trials. So, I started looking, and that website is awful. I mean, through the years, I have learned how to navigate it properly. And have a system, but I rely very heavily on an organization called Cancer Commons, which is like a team of physicians and researchers and scientists, and they help cancer patients out. They help them, not only look for trials, but also help you like decipher, any like scan that you get or news from the doctor or pretty much anything. So I've been working with the same woman for 5 years probably now, or over 5 years. And she's always helped me, and she will, if a clinical trial that I don't see, she knows of or hears about, they stay up to date with, the conferences and news that comes out of the conferences. And she's very helpful to give me ideas that I bring to my oncologist and ask them about, just so that I have like a little ready going list of possible next steps. So that's what I have been doing, formulating for the past 5 years. So I'm always ready to go. But so my first trial, I did a vaccine trial, a personalized vaccine trial. And I was unfortunately combined with immunotherapy, which I cannot tolerate very well. And so I ended up having to get off that trial. But I would say in general, like to echo what they were saying, the amount of care you receive is just amazing. I mean, you have people like a text away or an email away, or, nurse coordinators and, all these people. And you have even like a handout, and they're going to like be ready to go and tell you what to do. And, whatever, they're just always there, readily available. And I feel like it's a lot of the downside to the trials is the travel and the time that you have to spend there. And I wish that they could keep what happens during COVID, when you have all these virtual visits and all these things, that they were kind of diverting, where you could do things at home in conjunction with traveling, because a lot of people don't live right next to a cancer center. And I feel like that was the biggest drawback for me, is when I find a trial, is how far away is it? How often am I going to have to be there? How much of a pain in the butt is it going to be? Is it going to give me, side effects right away? I'm not going to be able to leave. How, those kind of questions were the big ones for me, is just the travel and time commitment, stuff like that. But other than that, I feel like when you're on a trial and you get into this routine of that trial, it becomes easier and more relaxed. And I don't know, I guess that's it.
That's great. That's great advice. And speaking of advice, that's what we're going to go into the next question. I'm going to ask each of you this: what advice would you give to others recently diagnosed? What have you learned from your journey that you wish you knew at that time? And, not only for those who are recently diagnosed, but maybe just now facing a recurrence. So if you have any words of wisdom to share with those folks. Let's start with Terri.
Words of wisdom. Wow, I like to handle a lot of those. It does start with the biomarker testing, but let's just presume for the sake of argument that you got that biomarker testing done. And, I say absolutely connect with a sense of community and get connected with the other people that have that same biomarker, because it really seems to be making a difference as far as what kind of treatments are going to work or aren't going to work for you. And it also gives you that sense of, that camaraderie that, like the integrative oncologist was speaking about earlier. You've got that sense of community, that sense of commonality. And to me, it's like it felt, when I found out what I am, it was like it named the devil that I was fighting. And it gave me this sense of everybody can come together over the same battle. And so that was very empowering to me. And it gave me the opportunity to learn where to go to look for educated hope, not just randomness, but actually knew what I was looking for.
Thank you. And now if we could go to Jessica.
So my first advice to patients is always become your cancer's best friend, which sounds funny, because a lot of times people like to talk about cancer as the enemy. But the reality is that the more that you can learn about your disease, the better outcome you're going to have. In colorectal cancer, we actually have 2 really good lines of therapy. So time is of the essence for learning about your disease. So as far as learning about your disease, what I usually recommend to newly diagnosed patients or people experiencing recurrence, especially if you just become stage 4, is to have biomarker testing done and find out, what might be actionable. There's some great services out there that can help you interpret the information that you get back from your biomarker testing. The other one that I recommend is to go see subspecialists if you're stage 4. So besides getting a second opinion with a med onc, which is like a general medical oncologist who would prescribe systemic therapy, if you have lung mets, go see a lung specialist. If you are thinking about surgery, go see a surgeon. Because the reality is that medical oncologists, especially if you're seeing in the community setting where they're seeing multiple types of cancer, can only stay so current with so much because there's so much information coming out every day. I know in lung cancer, there's been so much progress this year. Like, how could a community oncologist be on top of all the amazing progress that's happened in lung cancer versus what's also happening in gynecological cancers versus colon cancer? So it's really important not only to see someone who subspecializes in your type of disease, but then also in targeting whatever you want to do. Because I'm actually a really good example of that, because for years I was told that nothing could happen to my lung mets. But after participating in my clinical trial and getting shrinkage, I was able to be referred to an interventional radiologist who performed 12 lung ablations and was able to cryoablate and successfully kill 12 tumors in my lungs when I was told that my lungs would never be touchable. And my medical oncologist, when I went back to him after them, was surprised that she was able to do that. But it turns out there's been new research that's allowing them to approach lung metastases in colorectal cancer differently than they did 5 years ago. So it's really important to see those subspecialists.
That's great advice. James.
I would say kind of like what Jessica said, become a student of the disease, to become a student of your own mutation. And to her point, these physicians are challenged, especially in these community settings, with trying to know everything about everything. And what I can tell you is, even as a fairly smart guy, it's impossible to know everything, even about one mutation, much less to try and know everything about every cancer. So trying to get to that thoracic oncologist who can specialize even further into what you have. The other thing I would say is just becoming your own best advocate. You are the one who has to live with the results of this. And sometimes I talk to newly diagnosed people, and I think if this were your vacation and your travel agent said, you're going to Tahiti and you're going to stay at this hotel and you're going to eat these meals, we would be like, what the heck? It's my vacation. I got a say in this. But yet when it comes to our own treatment, a lot of us are like a person who's letting the doctor play travel agent for us on a vacation that is actually life and death. So we need to take control of what it is that's going on with our treatment. And again, be your own best advocate. And the last thing I would say is just building your support network. Whether that's folks at your work, if you're still able to work, whether that's home, church, family, whatever that looks like. Time as a phone buddy who are trying to do this kind of alone. Build your network, build people who can check in on you and can help you when times are tough, mentally, physically, and otherwise.
Thank you, James. Jackie, would you please share?
I mean, I don't know how I can add on to all of this great advice, but I would just say the single most important thing to me is to make sure that you have a second opinion. I think if you're seeing a a general oncologist, I think it's so important to get to an NCI center and see somebody that specializes in your cancer. That's my one big one.
Thank you. Thanks. That's great advice. So James, you were talking about, I mean, not only were you talking about it, but I see in action how you build others up. You answer people's questions, other patients who have questions and needs, and you're always there. And Terri was talking about community, and so I just wanted to get your comments about the KRAS community is not even. I mean, this organization is not even 2 years old yet. I remember the day Terri was was told she was KRAS, and she walked into my office and told me, and I'm like, wow, really? Have a seat. Let's talk. And it was, my mind is blown to think about what she has done in the past, whatever it's been, 18 months or so now. And I just wanted to find out from you folks, what has the KRAS community meant to you? And maybe what do you see as its future?
So it's great to see Jackie online. In fact, I wish I could see her better with where we're sitting. I can't see her that great, but Jackie, I wish you were here. I remember going to my first really big lung cancer conference, and everybody went into their breakouts, kind of like what Terri was talking about a minute ago. And one of the organizers saw me kind of wandering around aimlessly, and they said, "Oh, you need to talk to KRAS Jackie." And so Jackie and my wife and I had like our own little breakout session at a table because we were it at this particular conference. And so I look at then, that was what, 4 or 5 years ago, and where we are here. And yeah, it's amazing. It's awesome. And I said then we didn't have, I thought part of it was that there just wasn't that much positive to talk about then. And I contrast that with where we are today, and there's so much positive to talk about, so much hope. As a G12D'er, I'm seeing this stuff and I'm like, okay, 4 more years, gonna make it, 3 more years. So it's something that where we have a targeted therapy. But it's so cool to have other people that are sharing the same thing, and also to now recognize this cuts across lung cancer to other cancers. So there's even a bigger sense of community.
That's true. So how about if we go to Jessica now to comment on that?
I'm glad you came to me, because this is something that I was hoping that we talk about. I heard about KRAS Kickers because last year I was asked to participate in a white paper for ACCP about how it helps for patients to be connected to biomarker-specific patient groups, and what a difference that makes as opposed to tumor-specific patient groups. So when the paper came out, I heard about it and I joined KRAS Kickers. And this was around the time I was having brain surgery, so the memory is a little foggy, but I lurked for a while and just hung out. I think I might have been the first colon person in the group. And eventually I got my feet under me and started commenting on stuff. And one day Terri sends me a message and says, "Hey, you're a colon person." What's up? And I was like, there's a lot of good information here. And I was thinking about this expression that is, you can see further when you stand on the shoulders of giants. And lung cancer and colorectal cancer are unfortunately the #1 and #2 cancer killers. We all know that. And they're also I think in the lowest 5 funded cancers. And in colorectal cancer in particular, G12C prevalence is extremely low. So I realized if I wanted to know more about G12C and then about KRAS in general, I would need to join in with my lung cancer friends and start getting involved. So as time went on, I got more active in KRAS Kickers, and I met some wonderful people on there who have become dear friends now. And I can't wait to finally get to meet you guys in person when COVID stuff is over. But I just feel like in the end of this, and especially, with all these clinical trials, we will all have to work together in order to find a good outcome, because it's so specific, this study, right? So they need more of us to participate, and so few people want to participate in trials. So really, I'm here today because of the lung cancer people who signed up for the very first 12C trials. And, you know, it'll go on like that. And I'm so grateful for it. And we're just like making so much progress when we work together.
Thank you, Jessica. Jackie, KRAS Jackie, would you like to add anything to that? We're coming to I think I'd like to ask one more quick question, but I don't know if we've got enough time. Okay, well, if
Go
you
ahead.
address that, Jackie, and then we can go to one more question.
Okay, yeah, no, I just found out about KRAS Kickers. I think I had already been, you know, talking with other like mutated people, and it had come up that they were part of KRAS Kickers. So I was like, well, I gotta be a part of this. Where am I? So I think that it's great because I was always so jealous of all these other groups and all the information they would be able to share with each other. And I just always felt disappointed when I found out I had KRAS, to be honest. And I never thought that we would be able to have this kind of community, even though we have the largest number of people with KRAS. And it's just nice to know that now is the time, you know, and there's a lot of incentive for drug companies to create drugs for this large group of people. And here we are already. So
Absolutely. That's great. Now, one just quick question, just like a round robin. I'd like to find out if there was one thing from our amazing, brilliant speakers today, what one thing is your takeaway from the conference? I'll start with James.
Yeah, I think we called it pipeline of hope. I think just realizing that there is hope on the horizon, and you know, it's all of our jobs just to stay alive long enough for it to be ready for us.
Great. Jessica?
Same thing. I really enjoyed getting to see some of the research this morning, and I am so excited just for the next years.
And Jackie?
same here. I love seeing a pipeline of drugs. I like it when it's extra long. I like to see when there's so many that I'm like, wait, what's that one? What's that one? And that's just good news. Good news.
That's great. And I am going to turn the baton over to our fearless leader, Terri, and for final closing.
Okay. Hey, you know what? That's a great way to kind of like end this all, because the reason we call this a pipeline of hope, because that's literally what this is. The pipeline drugs, which is what they're in studying and they're doing, that is tomorrow's treatments that they're doing and working on. And I got to say, if there was one big.
You want me to take this? Or
No. Okay. All right. If there's one bit, oh, there we go. You don't need me doubled. Okay. If there's one big thing that I thought was just, I mean, it just made me so happy this morning to hear when they heard from Daryl McConnell from Boehringer Ingelheim, which I'm sorry, I just stutter on. That they're going to be able to help us access and know what all the clinical trials are that are KRAS or KRAS driven, not just have to go traipsing around the .govs and whatever, to know here that there's 200 or more, and they're going to help us stay up to date on that. That's amazing. That is exactly what we need, and that is the sense of community that we need to have to be able to share that and be able to do it. Because not only can we get information from those, we need to be able to connect with each other. We've got people in here that have been in clinical trials. I have not. And at the same time, those are a lot of times the places where we're starting to see earlier and feeling that sense of community. Okay, we're just kind of all wrapping it all up together. It's a sense of community and a sense of belonging together and having that same commonality and the same common enemy for the fight, for the battle that we've got going on. Because, you know, like you were saying, like Jackie and Jessica, I'm sorry, and I'm getting tired. We're saying, you know, it's about being empowered and educating of yourself, okay? Because we need to be able to put together our best team members, okay? And the best team includes the best doctor, that includes the tumor board, that includes the integrative, and that includes second opinions. You know, they don't even go and play football games without a backup quarterback, okay? So they need to have another set of opinions in order to be able to have a really solid game plan, and you are the one with everything online.